Hello, this is Dr. Do again. This video is still on alphabetic list problems, still on letter M. Today I'm going to talk about a group of diseases, myopathy, which is not the cardiomyopathy, it's the disease occurring in skeletal muscles, related to the skeletal muscles, either the inflammation or the damage, or necrosis, or autoimmune caused myopathy. So let me just first of all bring up the emergency situation. Any emergency situation associated with this myositis or myopathy warrant emergency visit. There's some, yes. It could be serious. It's not because of the muscle itself, but because of the breakdown of the muscle release the rhabdomyoglobulin, which can damage the renal tubule, cause the acute renal failure. So that's the emergency situation. Usually after either the medication caused, or I think one of the most common causes for this kind of condition is after the long distance running marathon, for example, during the way without very well rehydration, so cause this acute myopathy, release this rhabdomyoglobulin and cause renal damage. So if that's the case, what are the signs? In addition to the muscle pain, the change of urine color, because this rhabdomyoglobulin also gave the red color, so that's the sign. If that's the case, also sometimes associated with other conditions, feel muscle weakness, tender, and this change the color of urine. So if that's the case, you need to run to the emergency after you run the marathon. This kind of myopathy you can manage at home. Since this there are so many like muscle strains or mild injury, these are you can manage at home, like a strain or you bump somewhere, of course. But when I talk about the myopathy, probably referring to those serious skeletal muscle diseases, either autoimmune cause or medication cause or other causes. So probably need to be managed by the physician, even though the recommendation or the treatment probably just the anti-inflammation from over-the-counter like Motrin, but still need to be under the guidance of the physician. So this is about this myopathy. What are the, before I talk more about this myopathy or myositis, let me just bring up the functional structure of the muscle. So muscle is a unique organ, it's a tissue, and also it's an organ. Each muscle is an organ. The cells of this muscle is different from other cells. It's a spindle-shaped, long-shaped, and for the skeletal muscle are the striated, which has like a groove. Those lines are formed by the elastic tissue as anchor, so the muscle fiber cells can contract along this striated line, called Z-line. So that gives the special unique structure under the microscope, and also the unique structure that the Z-line, the striation of the muscle tissue, really is like an anchor to hold the muscle fibers to elongate it or to shorten along the Z-line. So that's the fundamental structure. Of course, the muscle cells is also the same as other cells with microorganelles. And the muscle is also, like the heart, work 7/24 without stop. Because even though you think I did not move my arm, did not move my legs, I'm sitting here, that still required the muscle tone to maintain the normal posture, the position. So the muscles, skeletal muscle is just like the heart muscle. You couldn't feel it. Works 24/7, continues to work here, there. So that this is just saying that the muscle requires huge energy. Where the energy come from? Pretty much from the storage glycogen. So the glycogen breaks down to generate ATP and to supply, and also require a huge amount of oxygen. So this is about the unique part of the muscle. And So that's why the muscle store the glucose for glycogen in order to maintain this constant function. And the muscle diseases, clinical diseases like myositis, either the generalized or only dermal myositis, the different forms, or actually the most common of this myositis, probably the medication called the statins, the medication which are used to lower the blood lipid. However, the point is the statins cause the muscle necrosis or the myositis caused by statin is not the most common side effect of this medication, but it's serious. So then every time either exam or clinical or the medication have to say this myositis caused by the statins, just because it could be serious. The most common side effect, by the way, for the statins are the digestive system, the GI upset. So this myositis, however, it's most commonly mentioned because it could be serious. So what are the why it's so serious? Because like I mentioned, the myositis causes necrotic, release the rhabdomyoglobulin that damage the kidney, tubule, necrotic kidney failure, or the imbalance of the electrolytes, because this necrotic or necrosis process of the muscle cells release huge amount of potassium. So that's the serious worst consequence for this. So there's some chronic, I'm talking this myositis caused by medication or after the marathon, kind of acute. There's some chronic causes of myositis related to the autoimmune reaction, either generalized or localized dermatomyositis. It depends on the structure or the damage. It could be damage to the different membrane structure around the muscle cells. Around muscle cells, by the way, there are different layers of the membranes, the peri, endo, or so those membranes are affected differently through different mechanisms, caused either generalized or dermatomyositis. Anyway, so the symptoms of this chronic autoimmune caused myositis are similar like other autoimmune disease. Feel stiffness, feel pain, may or may not have rash, and in terms of diagnosis, is similar to the other like rheumatoid arthritis. Draw the blood, test the antibody, and test the cell like CD4, CD8. That's the causes for this kind of myositis. In terms of management, similar to the other autoimmune diseases, use the steroids, probably the first line, very well recognized treatment for this myositis. So anyway, and for those chronic autoimmune caused myositis, usually really it's occurring in the female, middle-aged female, quite common, just like other autoimmune caused rheumatoid arthritis or lupus, for example. So these are the briefly introduction for the muscle structure and muscle diseases or myopathy, myositis, or necrotic process. So I hope it helps, and just give, particularly for those like to do the vigorous long-term muscle exercise, just remind, make sure you drink fluid to prevent this renal damage. So that's the take-home message for this, and I hope it helps. And thank you for watching. I will see you next time.